We've reached the official start of the Atlantic hurricane season, although we've had named storms already this spring and other natural disasters already during the coronavirus outbreak. Tornadoes in the south in April, dams bursting in Michigan last month when Governor Gretchen Whitmer said,
"To go through this in the midst of a global pandemic is almost unthinkable. But we are here, and to the best of our ability, we are going to navigate this together. So please, to the best of your ability, continue to wear a face covering when you go to a shelter or go stay with a friend or relative. Please try to protect yourself if you are able."
People in natural disaster zones could face threats on two fronts, the disaster and the coronavirus.
Obviously, with the threat of wildfire season and hurricane season, COVID-19 doesn't really care about any of that.
Brock Long was administrator of FEMA, the Federal Emergency Management Agency, for nearly 2 years under President Trump.
I think we're going to continue to see peaks and valleys of the virus in various portions of the United States. It's hard to say whether or not there's any seasonality, to the virus currently. But many communities are continuing to see the number of cases spike. But regardless of that, Mother Nature is going to continue to do her thing too and pose new threats as well. As we come around to hurricane season, we've already seen 2 named storms.
Yeah, and look, if there's a named storm, your priority has to be your immediate safety. You can't worry about social distancing. If you have to leave your house, you have to leave your house, right?
That's correct. Going into hurricane season or wildfire season, the 50-meter target is going to be, protecting and saving lives from those types of events, trying to do the best that you can to protect people from those situations. And then the secondary response is trying to reduce the spread of the virus as people congregate in shelters or to evacuation locations. And it's going to be complex and hard when it comes to the response and recovery phases of disaster.
Yeah, just if a storm blows through, then you've got to try to keep people safe from the virus and from the normal post-storm stuff, and then you've got to keep the recovery workers safe too.
That's true. So I think what you're going to see, and FEMA's already put out a tremendous amount of guidance in what we're calling co-response planning. The response to COVID-19 is going to continue as state and local governments ramp up their readiness to be able to handle anything tropical or anything to do with wildfires, or let's just say flooding or natural disasters. FEMA's put out new guidance. They're also conducting webinars on a regular basis to make sure that people are kind of altering their response and their traditional response and recovery plans. And I think that they're leaning way far forward. And I think, quite honestly, there could be some unintended positive consequences in the emergency management arena as a result of COVID-19. I think, FEMA has been trying in the past to do things more virtually and reduce the number of people that they're deploying out into the field. And I think COVID-19 is going to serve as a catalyst to figure out ways to do disaster response and recovery more efficiently in the future.
We've already seen a couple natural disasters since the pandemic has been here. There are some tornadoes in the south, bad ones in April, and the Red Cross used hotels and dorms as much as possible for families. And then there was this bad flooding in Michigan with those dam breaks where they tried to keep people as far apart as possible in those shelters. So they've already had to try to deal with this on a couple of levels.
Right. So in some cases, you don't have too many choices when it comes to helping people who have been displaced by disaster. And you're still going to have to rely on traditional shelter operations, but taking into account some public health aspects of, social distancing within those. And the problem with that is that the social distancing can reduce the number of people that you can place into a shelter. But I do know that, governments like the state of Florida and other states and local jurisdictions are looking to how they can do what's called non-congregate shelters by using hotels, motels, or, college dormitories as additional options to house people who have been displaced through evacuation or lost their homes as a result of a disaster.
You were on the show a couple of months ago. Talk about the progress you've seen since then with the coronavirus response at the federal and state level. What have you been pleased to see, and what are you still looking for?
I think that a lot of the supply chains that we depend on as Americans have stabilized. The grocery stores, did very well. The food supply chains did fairly well. And yes, there are some frustrating days where you can't get some certain things But for the most part, I think the private sector has done a great job of trying to maintain the supply chains and continuity of those supply chains during this complex event. I think that, the federal government has also worked with state and local governments in the private sector to really try to overcome the gaps in medical supplies and ventilators and PPE. And while it may not be perfect, for the most part, they've been able to stabilize the public health system as well. Now, we're not in the clear of this thing. We really don't know what's going to happen in the fall, whether we're going to see additional spikes. But as we talked about earlier, some communities are seeing spikes now, whereas others are seeing the trends, go down in the virus. So we're still going to have to stay vigilant as Americans and trying to do the best to not only protect ourselves, but protect our neighbors by practicing some social distancing, making sure that, we wear masks, in certain places, and trying to do the best to uphold proper hygiene and take care of our neighbors, because this thing is not going to go away until a vaccine is found.
Well, I've heard you say before that we, as citizens, are the first responders, and so I guess all that is part and parcel of that. Take care of yourself as best you can. The feds have been more hands-off now. This is being left more to states. You were an emergency management official in Georgia. They were one of the first to really kind of kick open the doors. Do you think that state-level decision-making now is appropriate at this point, or would you advise a more unified guidance from the federal government?
Well, I'm a big believer in states' rights. And, I think each state is unique. Each state is facing different circumstances, whether it's a virus or whether it's natural disasters. And I think that the federal government's role is one of support. And, you've heard a lot of, one of the things that I've been always saying about disaster preparedness, response, and recovery, it's locally executed, state managed, and federally supported. I do think the federal government has a right to question whether or not some decisions are rational or not. But for the most part, I believe that the federal government plays a support role to these governors, and that the governors probably have the best information about their state and, should make the rational decisions and what's best for their citizens pushing forward. But here again, we're all in this together. Citizens are the true first responders, whether it's for COVID-19 or for natural disasters. Largely, the decisions that citizens make right now, if they're going to go out, put themselves out in harm's way, they're not going to practice social distancing, they get sick, they get other people infected, then it puts a strain on the government response the more that people do that. And, I know that people are tired and I know people are frustrated, but lives are at stake. And so then again, I think, the first line of defense is always citizens need to take the approach that they are the true first responder in protecting their neighbors, as the government's trying to do the best it can to stabilize supply chains and the public health system to be able to support us.
President Trump says that he was left with a bare cupboard by the Obama administration when it came to deal with a crisis like this. Former Obama officials say they did leave behind a pandemic preparedness blueprint that was completely ignored. Do you have any insight into either of those accusations, or do you just kind of let it wash by you?
Well, I'm not, having been a former FEMA administrator, I'm not one to point the finger and place blame on this administration or the previous administration or whatever. But I do think that COVID-19 exposed a real weakness in our public health system. And our entire public health system needs to be rethought as a result of going through COVID-19. So let's talk about that a little bit. I mean, one, your local hospitals do not store a large amount of supplies in case their supply chains break down. A lot of the hospitals were based on one vendor, not multiple vendors or backup vendors in case their supplier, fails to be able to get them the PPE or the equipment that they need. Two, the medical suppliers, the major medical suppliers to these hospitals, basically had all of their contracts in foreign countries, China, Malaysia, wherever it may be, and there was not, and as a result, I think there needs to be a Buy American or an independent public health campaign to where we build our own capabilities and we're not reliant upon other countries, whether it's for PPE or vaccines. And, I'll give you an example. We grow a lot of cotton in this country, but we make very little, protective equipment up until recently when we had to face this virus head on. And so a lot of the systems that were put into place to fight, pandemics like the Strategic National Stockpile were never designed to handle anything of this magnitude. And it's not just going to be, we need to think about a bigger federal government response in the future. It's how do we bolster, citizen capability, state and local government capability? How do we build a robust public health system, that has multiple avenues of continuity when they lose a certain supply chain or resource or staffing, whatever it may be? How do they continue to meet their mission and central critical functions, as well as what the future of the strategic national stockpile and the public health industry should look like from the federal level?
Did you guys, when you were with FEMA, did you guys ever game out what happens with multiple response needs at the same time? There's a biological terror attack and a tornado.
So often we would hold national level exercises. We would hold exercises with our partners at HHS and all the different federal government agencies. And, FEMA, particularly when I was in office from 17 to 19, we went through real life scenarios handling multiple events. And so if you go back and look at 17 and 18 as FEMA Administrator, if you look at the amount of recovery dollars that are going to go out to fix communities as a result of all the hurricanes, the wildfires, the volcano, the earthquakes, everything that we had, it adds up to where it is more than the 9 previous FEMA administrators before me combined.
Wow.
So FEMA has had way too much experience over the last couple of years handling multiple large events at the same time, and COVID-19, unfortunately, is adding to this. But they also do a lot of planning and training and exercise leading up to different seasons, such as hurricane season. And I do know that FEMA and HHS went through an exercise for pandemics called Crimson Contagion before we saw COVID-19 impact our country.
Former FEMA Administrator Brock Long. Mr. Long, thanks for coming on the show again. Maybe we'll catch up down the road as this progresses.
Thank you very much. I appreciate it.